tell me how you're doing today?
I'm doing a little bit better since I came into the hospital, but
What brought you into the hospital?
well, I was at work and I was really stressed because I had a big report due that I was behind on. So I started feeling really short of breath and I had really bad chest pain, and then I ended up feeling faint and passing out.
Have you ever felt this pain before?
Not like to this point, but I have had really bad chest pain before. I thought it was just because I was nervous.
Tammy, maybe it would be best to put your computer away for right now while you're in the hospital.
But I have so much work I have to get done.
I know, but it sounds like the stressor is a huge part in your life right now. And I just wanted to talk about your medical condition.
I guess you're right. Maybe I could give it a break.
Have you ever had any other health conditions before?
No, this is my first time being in the hospital.
Okay. And you said you felt chest pain before,
Yeah.
but you've never done anything about it.
No, mostly just when I'm at work.
Okay. When you came into the hospital, you were in SVT, they found.
SVT, what's that?
It's a dysrhythmia in the top part of your heart. A dysrhythmia is just like an irregular rhythm that your heart was beating at. And this can be caused by stressors or caffeine, alcohol use, or any underlying conditions with your heart. So we're just going to check out if you have any other conditions going on with your heart.
But it sounds like any other issues.
I know, but you said you felt chest pain before, and it sounds like angina. Angina, do you know what that is?
No.
Angina is a condition in your heart that can be caused by stressors, caffeine, alcohol, smoking, and it reduces the blood flow to the heart, causing chest pain.
Well, now that you mention it, I do drink a lot of coffee.
Yeah. So I've been talking to your medical care team, and they are going to prescribe you a medication called Lopressor, but it's also, the generic name is Metoprolol. Have you ever heard of it before?
No.
What it's classified as a beta blocker. So this is going to help block certain receptors in your body that constrict your blood flow to your heart. It's going to help open it up and get blood flow to your heart and take off that strain that's on your heart that's causing that chest pain.
Okay, so now I'm just going to pull over a chair and talk to you a little bit about this new medication you're going to be going home on.
Okay.
So some of the side effects that you may experience with this drug are hypotension or low blood pressure, a slower heart rate, dizziness, lightheadedness, feeling like flushed, weaker than normal, or feeling just very fatigued.
Okay.
Some serious side effects of this drug include causing symptoms of heart failure.
Oh boy.
So you want to make sure that if you notice any of these next symptoms I'm going to talk about, that you contact the provider right away.
Okay.
So if you feel short of breath, if you notice that you have any swelling of your ankles and your feet, or if you notice any sudden weight gain, you're going to want to make sure to call your provider. Some other serious side effects that the drug can cause are fainting, so similar to the episode that you experienced the other day. Some blue fingers or toes, trouble breathing, like I mentioned, or any mood changes, like depression or a new onset of
So
confusion.
if I'm not feeling like myself, I should probably call.
Yes, exactly. So with this medication, you want to make sure that you take it at the same time every day.
Okay.
And you want to make sure that you don't crush or chew the tabs.
Okay.
And that you call the provider with any of those signs or symptoms of heart failure. So can you...
Such as if I'm feeling short of breath, if I have swelling at my ankles or toes.
Yep, your feet.
My weight gain, if it's dramatic.
Right. You
or
want to
if
make
I'm
sure
worried
to
if
call.
I like faint again. Or if I don't feel like myself and I'm worried.
Exactly. And you also want to take this drug either with a meal or right after a meal because it helps with the absorption. And then you want to take it the same way at the same time each day, like I mentioned, just to make sure that you don't get that chest pain again.
Okay.
And we also want to limit the amount of caffeine that we take in. Because as I said before, that can exacerbate the chest pain.
Does that have to start today?
It should.
Okay.
Oh. Thank you. This is the first step to making a change.
It was just such an awful feeling. I just don't want to feel it again. And if it means cutting back 2 or 3 cups a day, I guess I could only have 1.
Yeah, maybe start with like, having a cup a day, and then maybe even, to half a cup a day after a while.
Okay.
You also said that you're really stressed at work.
Yeah.
And I noticed you were doing a lot of work.
Probably give this up for now.
Exactly. Stress management is a really important technique to use in order to prevent these episodes of chest pain.
Yeah.
So something that may help is writing in an agenda or a calendar so you have everything organized in front of you.
So I'm not late again for that paper my boss yelled at me about.
Exactly. And that way you'll stay organized and things won't come up as quick without you knowing, and hopefully will lessen that chest pain.
Okay. So I'm going to limit the amount of coffee I drink, and I'm going to try to plan out my time better so I don't get as stressed.
Right. And then if you are starting another medication or an herb or a supplement that's over the counter, you want to make sure to let either the pharmacist or your doctor know, because this drug can interact with other things. And then I'm also just going to teach you how to monitor your heart rate, since one of the side effects of this drug is a lowered heart rate.
Okay.
So what you're going to do is you're going to find your pulse on your wrist, go down from your thumb, and with 2 fingers, your index and middle, you're going to lightly feel for a pulse. Do you feel it?
Yeah.
Okay, so now you don't want to push too hard because that may block it off, but you're going to time for 1 whole minute and count how many beats you feel.
How many beats should I have?
You should feel between 60 and 100.
Okay.
So you want to make sure if your heart rate is below 60 that you call the doctor, because your dose of your medication may need to be adjusted. And since most people don't have blood pressure cuffs or machines at their house, a good way to check yours without having to go to the doctor every time is to go to like CVS or Walgreens, because they always have walk-in blood pressure machines you can use. So Sammy, do you have any questions about the medication or anything else?
No, I think I got it. I have some tools I can work on for now, and I know I can call you guys if I feel worried.
Okay, sounds good.
Thank you.
So we used TeachBack, and it was more of a conversation with the patient than like information just being told at the patient.
Yeah, we wanted to make sure that it was really personal and that the patient really understood everything that we were throwing at them, because obviously that's a lot of information for someone who doesn't know anything about, the medical profession to understand. So we wanted to make sure that we assessed that they actually learned utilizing the TeachBack method.
And we gave her tools that she could use that were really applicable to her, because she came in because of her stress and she was having a lot of caffeine intake. So we taught her ways to manage that with a calendar and reducing the intake.
Yeah.
And the heart rate, we taught her that.
We just wanted to really make sure that when she was leaving on the medication, she knew everything that she needed to know in order to safely take it every day.